We're at Minimally Invasive Spine Institute today. It is a preeminent spine center in the city of Dallas, 10,400 North Central Expressway here in Dallas. We have the privilege and pleasure of being with one of the founders, Dr. Michael Rimlawi. Dr. Rimlawi, I know that your specialty is minimally invasive surgery. Would you give the viewers some idea what that's really all about?
Sure. You know, a lot of different types of specialties go towards minimally invasive. And really it's just all about technology. As we get more technologically advanced, our surgeries get better. And as they get better, our patients do better. And that's really what our main focus is here, is spine surgery, but technologically advanced spine surgery. So we do minimally invasive surgery, which means instead of the big cuts, small cuts. Instead of many days in the hospital, most of our patients go home the same day, and we use little cameras and new technological tools to basically treat their problems faster and less pain than the traditional big spine surgeries.
And you know, when someone comes to see you and you interview them, you get an x-ray here at the hospital, and you determine they really don't need surgery. What happens then? Maybe they need a chiropractor, maybe they just need some therapy, maybe they just need pain management. How does that work here at Minimally Invasive Spine Institute?
I'm glad you asked that question, because we built a team specifically for that. So if we have a patient that comes in, you know, I saw an 11-year-old girl yesterday. She didn't need surgery. She just needs some physical therapy, but her family was concerned. So we have trained physical therapists, we have chiropractors. So the people that just have the bumps and bruises and just some sprains, they don't need spine surgery. So we have that here. Some people need MRIs, obviously, or CT scans. We have that here as well. Some people don't need surgery, but maybe their problem's a little bit more serious than a sprain. So we'll have one of our pain management guys help them with that. And if it's something more serious, then our pain management physicians will send them to the spine surgeons and we'll evaluate them. And we get to do a team approach, which I love the most about this. So the patients get to see all the different type of modalities, and we sit down together and we find out what the best treatment option for the patient, getting to talk to all these other physicians in our group. And then we come up with a plan. So that's how we do it here.
You know, back pain can be one of the most excruciating pains that any human being can endure. And you know, I know you love your job because you're actually making people feel better. You're doing it with the least amount of pain and the least amount of stay in the hospital. And you know, the other thing that I like about this particular facility is you can just drive right up. You don't have to have, you know, a wad of cash to pay a parking toll. You know, you don't have to have valet. You drive up, you walk in, and it's just a great part of this facility. So let's make sure the viewers know how you kind of look at that side of the equation too.
Sure. You know, it's where I think medicine is changing, and what people's expectations are changing. They want things done better. And I did it the old school way where I was in a big hospital system. My patients would have to go up elevators and hallways to get to me, and then go down more hallways and elevators to go for MRI, and then more to a therapist. So we built everything, like you said, in one place where they really only have to go one place to get everything done, so they can get back to their job or home a lot quicker than if they went to the big hospital where they'd have to go multiple different places to get their things done.
You are such a prince for visiting with us today. I know you were just extremely busy this morning. I know you squeezed us in. I know you've got other places to go. Thank you so much for visiting with us today.
Thanks so much for having me.